Do implants last forever?
Uh, no, I don't think anything lasts forever. Um, but they do last a long time, and if you take care of them well, they can last for the rest of your life. Now you may say, well, what does that mean? Take care of them well, right? So, number one, you got to make sure you're following up with your dentist on a regular basis. They should be evaluating the implant. They should be evaluating your bite because all of your teeth are getting worn as you use them, right? So now what will happen is that the porcelain on your implant may not wear at the same rate. And so now you may, at some point in time in the future, be placing more functional load, or you might be biting harder on that implant than the rest of your teeth. So your dentist should be kind of going through periodically and looking at your bite, making sure that everything is all of your teeth are biting evenly and you're not getting too much forces on the implant. Because if you do, then you will overstress the implant and it can either fracture, which is pretty rare, but it can fracture, or more commonly, it's going to transmit those forces to the bone around it and you can start losing bone. So they can last a long time, but you got to make sure you're following up with your dentist. Another thing that should be done is once you do get an implant, you should be wearing a retainer of some sort because the teeth around it are going to move, but the implant is fused to the bone, so it's not going to move. So if it's not moving and other teeth are moving, then you can develop a gap, a small gap between the adjacent tooth and the implant crown. And that gap may be so small that you can't really clean in there with a toothbrush, but food can get jammed in there and bacteria and plaque can collect there. So that can also compromise the implant. So should be getting some sort of a retainer after you get an implant that's worn, usually at night or for a few hours a day or something, just to keep teeth in their position. So they can last a long, long time. It's rare that we see patients come back in with failed implants or things like that. But again, just like anything else, it's got to be taken care of.